welcome to Inside Edition to discuss national, regional and international issues in depth. The new coronavirus that originated in Wuhan, China has infected more than 24,500 people globally and killed more than 490. Due to the fact that numbers across the globe are on the rise, the World Health Organization, the WHO, declared the spreading of the virus a global emergency. As a result, there have been plane loads of passengers from various countries being flown back to home and into isolation wards. Global cruise lines have declared passengers from China a no-go, and flights from some countries have been grounded. The Kingdom of Bahrain is joining the global efforts in monitoring the developments of the disease, as well as taking all required preventive measures. To talk more about that, we are pleased to be joined here in the studio by infectious disease consultant at Salmaniya Medical Complex, Dr. Jamila Al-Salman. Welcome back. Joining me in the studio is Dr. Jamila Al-Salman. Thank you very much for being with us today.
Thank you much for having me.
Doctor, I know on the issue of this problem that's coming up with the coronavirus being a global epidemic, that your time is very limited, and that's why I really wanted to get it from you yourself on how Bahrain specifically is part of the whole equation of the coronavirus. What has happened in Bahrain, and do we have any coronavirus issues?
Thank you very much for having me, and I think this is very important to know for everybody in Bahrain, whether it's citizen or people living in Bahrain, that there are extraordinary measures that has been taken so far. And this, what I'm talking about, is the plan and how to really limit the first step, which is basically the entrance of any case of coronavirus to the new coronavirus to Bahrain, which we took. There are a couple of actually committees. There is one which is from Public Health Department with Ministry of Health, which works usually on the national level of the guidelines. And there are, committees in the military hospital, BDF hospital, and also in King Hamad Hospital. And there is the higher one, which is the kind of national level, which is headed by His Excellency Sheikh Mohammed Al Khalifa. Yes. Whether the whole measures has been taken into consideration and in collaboration with the whole international recommendation, which is basically coming from World Health Organization. We took some of them, as the reference for it, and we modified to our settings in Bahrain. So it basically goes with the whole measure of, first of all, how do we tackle the point of entry, which is the most important part, which is the airport or even the seaport, what we have. So we have a full plan. People were educated and trained to have a clinic in the airport where we screen everybody getting into the airport. So probably if you are coming back to Bahrain currently, you'll see that there are the thermal scanning, which will detect people who is having fever, but will not detect the other symptoms. So people, when they pass through it, they have to go to the passport station where they know actually ahead of time who is coming from China, and they will be directed to the airport clinic. And the airport clinic, the physician there will evaluate the situation, whether they are symptomatic, having any symptoms. Actually, we went even for milder things like just simple sore throat, will be directed directly to the isolation ward in Salmaniya Hospital, and then we will take the swab, do the necessary things. Right. And from the other, also the same things being applied at the seaport, where any ship coming to Bahrain and having people on board from China will have the same probably elements of filtering the case and making sure that it fit the case definition. Currently, so far, all the people who enter Bahrain, whether visitor or Bahraini, and I know a lot of people were wondering about these students who were in China, everybody so far is negative, thanks God. So we are monitoring them on daily basis, even the people who does not have symptoms. So we went with the recommendation from World Health Organization and CDC, where you can do home isolation to keep them, give them the whole instruction. And we actually took an extra measures, which is not done in a lot of countries, that we have a specialized team from Public Health Department. He calls everybody every day just to make sure if they develop symptoms, if they need any help. If anybody of them just develop any simple symptoms, we call them to come in for isolation.
Right. And in order to bring it a little bit closer, before we actually talk about how this virus is a mutation of any coronavirus that has come previously, what the doctor was talking about when you talked about the fevers, these are some of the first symptoms that appear before, a long time before the actual end effect, so people know that when they come to the airport and somebody does have a fever, this is actually one of the first symptoms, so it could be addressed very quickly. Also at this point, for people to know, the coronavirus before is a strain that has appeared before, but not one like this. How is this strain different? How has it mutated?
That's also very important. The coronavirus in general, the family of coronavirus has been there for years and years.
Yeah.
This is just a new version. This is why it's called the novel coronavirus.
Yeah.
And similar to it in our modern life, when we're talking about the SARS, which we are comparing to it, which happened probably 15 years ago. And the other one, which is the MERS-CoV, which we know that's been in Kingdom Saudi and then with other countries also in the world. It's exactly the same family, but when they really diagnosed the cases in China, like end of December 2019, and they tried to see the genetic, components of this virus, it was new, not like the usual coronavirus. And actually there are bigger groups of coronavirus which can cause for us the usual kind of flu symptoms, the common cold. It's not this virus. So all the information we know about the new novel coronavirus comes from our knowledge from the previous two, the SARS and the MERS-CoV. And so far what we know about it, and from the reporting for everybody, so all the countries actually working together to report all the cases, to study the virus, because it's new, so there are a lot of unknown about it currently, and so we are trying to gather as much information about it to really put our guidelines, how to treat people and how to deal with these cases, even as prevention or infection control procedures. So what we know about it, we are talking about an incubation period of 14 days, and this is probably the number 14 where it comes in the picture, and this is not knowing about it, it's from the other two viruses that we know of. But most of the cases actually they have symptoms within 3 to 7 days after exposure, so it's a kind of shorter incubation period. What we go with 14 because some people showed up within the 14 days. So the most common symptoms, and that's has to be clear to people, there is no one single symptom is peculiar to this virus. It's exactly the same as the flu illnesses or flu-like illness. So people have fever. It was common, actually, more than 80% of the cases they have fever. They'll have runny nose, sore throat, cough, mild cough. Then this is what happened, and usually start, as we say, 3 to 6 days. And then the people who had worse kind of case scenario, they've developed a kind of bronchitis and then a pneumonia. The cases of pneumonia has been varied from mild, which recovered, moderate and severe. The problem with the severe cases, where there's severe hypoxia and multi-organ failure, this is where patient actually died and they have a mortality. But the mortality of this virus, comparing it to SARS and MERS-CoV, much, much lower. We're talking about the recent start like 2%, now we're talking about 2 to 3% kind of mortality rate. For SARS, it's around 10%, and for MERS-CoV, actually it's more. It's like 20, and some cases 35%. So it can kill, but it's not as high as the previous viruses. But that all, as I said, it's subject to change, because we don't know what will happen, how the virus will change further.
Yes, right. When it comes to efforts that Bahrain has done, you mentioned some of them. The Ministry of Health in particular has taken it upon itself to work in several directions, protecting the citizens, sending protection to the affected areas, as well as bringing out some kind of an awareness campaign for people to learn more. So tell me more about those efforts.
So as I stated, the one that we talked about is the entry point, and then to the health system, because major part of your concern will be if we get a case, we don't want it to be disseminated. And this is where your health system, healthcare worker, whether they are the ambulance staff, the nurses or physician, whether they are working in emergency rooms, ICU, or in the usual medical or pediatric young age, they have to be educated about the virus, and they have to have the training of doing the infection control measures really as we are saying it. So there were a lot of education session has been done to the secondary care hospitals, like what we have in Ministry of Health, to the primary care physicians, to the nurses, to the private hospital in collaboration with NHRA. That has been a lot of education has been going on. Plus training even the people into the team of the national ambulance, because they are the people who will receive them, and training the people in the points of entry. A lot of education has been done and communicated for them, all the guidelines. So that's in general for the healthcare worker, and we're trying to expand to information to the public because a lot of fears can be created if you get the wrong information, and this is the time where people can, you know, spread any news and people believe it. But you know, I really encourage everybody, you know, just to go to the official site. And that now, if you go to the official site for Ministry of Health and the Instagram, we have now a daily report of how many cases that we actually suspected and how many tests we are running, and so far all of them are negative, and how we are monitoring the cases, because that goes in hand with the international recommendation, how each country has to contribute to the international community.
Exactly. And just to bring it a little bit closer to people, when we talk about the incubation period that you mentioned several times, it is the period where the virus first enters the body until it is fully prominent and takes over and gives you those kind of symptoms. And that's why that period is different from virus to virus, but it's an important period for the healthcare professionals to be able to test more. So the world has different information. The information we get from Wuhan, China, and from the European countries that have been affected are different, but they're filling into the same direction. So what can you tell us, how is the international community dealing with this epidemic?
The way all the countries in the whole world, they are committed to one like international health regulation. So what we are talking about, we have the same language, the same measures. Probably you will see that some countries, they took extra steps, you know, just, you know, to tighten the procedures they have, just to smooth the process how they are doing it. But the basic things, as you said, is the same. First, you have people in the incubation period, which is the asymptomatic part. There are no symptoms. And we know that the virus is very unlikely to be transmitted when there is no symptoms. And if there is mild symptoms, the risk is higher. And if they have severe, it's higher. That's when we say that people are asymptomatic can stay at home and really have a kind of isolation at home and being monitored. If any symptoms just start, they have to let the healthcare provider to know about it. But that's a step that we took. Now with the increasing number and having more countries actually in the world are having cases. So now in Bahrain, actually starting from today, we will isolate all the cases that are coming from China. Even without symptoms, it will be for 14 days. And we'll try to select the high-risk group, not everybody, because we have to prioritize the list and how it works for our setting. And then for people who are having symptoms, this is the people who will take them for the isolation ward in Salmania, do the test. If it is negative, and most of them now negative, we still insist in following the same recommendation and be in isolation for exactly 14 days, just to make sure no one will show the symptoms even later on. So that's the concept we are dealing with right now, and it's being recommended by the international societies. So all the countries are reporting their cases. All of them are following the same exactly measure. It varies with some details because that's based on the setting of the country and their resources. And here in Bahrain, that we are trying to do the best collaboration among the whole setting. And really we have like a beautiful collaboration between the Ministry of Health, Public Health, and you know the government and other governmental hospitals and the private sector. So we're trying all to make it work for the best for our citizens and people living in Bahrain.
Yes. We are prepared, that's what you're confirming to us, that we are prepared in facing this virus. How prepared are we if there is an actual case? That's another question people are asking.
Okay, so that will involve two parts. The first part is, if we have the case, the most important part is to limit the spread to another human being. And if you see, like even like reporting, if you go to UK or United States, they have one case, and then the close people contact, they get it from them. So it's very clear that you have to have the first case and then people get it. Exactly. So this is where infection control and prevention play a major role. That's where our healthcare worker, all of them, they have to be updated, knows how to do it correctly and how to use our personal protective equipment. The other part of the story that people are asking about it all the time is there is a treatment for it actually. So what we do with the cases. Mainly the major things that you have to do is supportive care, because there's no specific treatment for the virus. But from our knowledge from the previous coronavirus, which is the SARS and MERS-CoV, and so far the publication, you know, probably within the last 2 weeks, 3 weeks, there are 2 to 3 publications per day, because people wants to know about it, wants to know how to deal with it. So they've been using actually all the drugs that we use for other viruses like hepatitis C or HIV, and they saw some like, and even the flu, which is Tamiflu that we use it for the flu season. So there have been like people, they use them because when you have sick people, that's where really you can use some of the medication, not indicated, but has been tried. So these medications are available, we have them now, so we can use them for if we have a case and really need the treatment, they will be afford, can afford it to the patients, because we are using them for other clinical indication.
Right.
So that's basically prevention and the possible treatment that we have.
This sickness has initiated from Wuhan, China, meaning that one of the main reasons why it is spreading it is the traveling field, where people travel from from airport to airport and so on. It spreads. So what can people do if they're traveling in order to take precautions against this?
If you see, like when you go to the World Health Organization, there has been no documentation of any restriction of travel. But within the last 2 to 3 weeks, since WHO has declared really it's an emergency, and it's international, and the countries has to take extra measures. There are a couple of countries they stop anybody coming from China, whether Chinese or non-Chinese, should not. And there are severally, large number of airlines has stopped really the direct flight from China back and forth. So that will limit the spread of the disease. But you have the other people who are already, they left the country. So this is where all of us, all the countries, they are doing their first line, filtration process and how to detect early cases. But and this is where we have to really reinforce what we are doing again and again, just to make sure we are doing the right thing. So all the countries, they have the same measures, despite some differences in the details of how they are executing it.
Right. When we talk about the coronavirus or any other viruses, it's really important for people not to go into some kind of a frenzy and believe everything that's on the internet. What can you tell us about the myths, the pros, the cons of using social media, which is spread now?
Yeah, the problem with the social media, it's good and bad. As you said, there's we know that it depends on the kind of information and who is delivering this information. So the MOH Instagram is social media, but that's you have to go for a trusted website, or so that's what I recommend everybody. Please go to the Ministry of Health website or Instagram, and you get the right information. We are giving update every day, so you don't need to go for another source. And then you have WHO and CDC, they are updating their data almost on every day. There is a report and update, so just get there and see the right information. So that will probably can decrease the amount of fear and panicking that went through the people, because they don't know, or they don't know how to get the right information from which side. So go to trusted health societies or other institution like Ministry of Health, and get the right information, which is really makes a difference.
Yes. This virus particularly attacks the respiratory system, meaning people cannot breathe very well. They cannot really have a very good exchange of gases within their body, which is important. That's why the organ failure. And when we come and look at these things, this is not the first time that any country faces a virus such as this. But now, if the virus, if a patient feels that they might have symptoms, although the virus has not spread, are there any contact numbers? Are there any places that they can go to in order to say, okay, I just came back, or I just did this and this and I feel I'm sick? So what can they do?
The first part of this, the story, it has to be started with the case definition. As I said earlier, this is the season for the flu and the pneumonia. So that's it. So everybody will have, there is no single family, they don't have a member who has the same symptoms, but they have to have an epidemiological link, which is they have to be in China or coming from China within 14, or they have been in contact with somebody coming from China. So if they have any of these symptoms, contact with somebody that we know it's a case of novel, then we'll be taken in consideration. How we can take it? There is a hotline. There is a hotline for the institution, the health institution in Bahrain, where they can call the public health, so they can filter the case. They go through the definition with them and make sure that it is really fit the case definition. Once it's fit, they will ask them to transfer directly to Salmania Medical Complex. That's for the small hospitals or clinic or private or GPs. Bigger hospitals they have isolation places. So we recommend for these places, if you suspect the case, you take the sample and you keep the patient isolation in your institution. If it turns to be negative, and it takes usually 4 to 6 hours to get the results back, you can deal with the other patient. If it is positive, please transfer to Salmania. So we try to limit the patient in one place, not to spread the cases. So these hospitals have been sent, the guidelines has been sent to all the hospitals. They are aware about it and how to approach it. And there is a public health actually for the public, there is a hotline where we get the collaboration from the National Disaster Committee, where it has been assigned to the public. So if they have a question or they want to ask any question, they can call the number and will be answered for them.
Well, at the end, before we end this part of the show, I really want to hear from you any kind of recommendations to healthcare professionals as well as to patients. How should they act and how should they act?
Okay, for the healthcare worker, the most important really message, be updated, because as we are saying, the virus or the information about the virus is keep changing every day as much as we know, and they have really to implement the best practice of infection control. That's the key for all of them. And for the people in general, for the patients, they will be under our care, and we'll do the best we can for them if we have a case. And for all people who are suspected or are coming from China, we actually will tell them that we are monitoring everything with you. We are trying to help everybody, and if you have any symptoms, you can get to us at any time. And to comply with the system of the isolation and all the recommendation, because that helps everybody at the end. The general the recommendation for the public, take the information from the trusted really websites or sites in general, and please to protect yourself if you are traveling or going to areas where they probably have some of the cases, to take the basic measures, which is hand washing, cough etiquette, and to try not to be involved or get close to people who are sick at this time.
Right, perfect. Thank you so much for being with us today and answering all of our questions. And we would also like to thank you, dear viewers, for watching us, and we'll see you next week in another episode of Inside Edition.